Hello, West Texas, and welcome to Vital Signs Podcast. I'm William Hatton. I'm the Public Affairs Specialist here at West Texas VA Healthcare System. And today I'm joined by Nickie Starkey. Thank you so much for being with us today.
Happy to be here. Thank you, Will.
Awesome. I am excited about talking about social work because it seems like, one of the more important things that we do around here. At least I'm sure you kind of feel that way, right?
I agree with that. Yes.
Why don't you take a little moment to kind of introduce yourself and tell us about your role here at West Texas.
Sure. My name is Nickie Starkey. I'm the Chief of Social Work Service. I have been with the West Texas VA since 2012 when I started as a social worker at the domiciliary. I then took a turn over in HUD-VASH, which is our healthcare for homeless veterans and our homeless population, doing a little with Veterans Justice Outreach. And that turned into becoming the active Chief of Social Work Service and a permanent position as the Chief of Social Work Service.
Okay, awesome. So, if you haven't heard already, we just released our latest edition of Vital Signs magazine. I know we like the Vital Signs name so much that we named everything Vital Signs, but it works for us here. And there's a whole 2-page kind of display for social work. I mean, if you get a chance to look at this, it really goes into detail about everything. I assume it's all of the social work programs. Is that correct?
It is. Social work service as a whole is a huge umbrella with several sub-programs underneath it that help our veterans, our caregivers, veterans' families, to be able to obtain social supports and services, as well as navigate their way through the VA system, having a support system all the way through.
Mm-hmm. So going through the magazine and the different programs, one of them that stood out to me, at least in terms of what we've been doing here in the Public Affairs Office, Make the Connection.
Yes.
I think when we try to put out a lot of content on social media, and one of the things that is kind of important to me, at least, is suicide prevention and things like that, and Make the Connection seems to be a really good program for that. Can you tell me a little bit more about Make the Connection?
Sure. Make the Connection is exactly what you stated, more of the mental health component for social work services. It is a program that helps veterans connect with other veterans, whether it is face-to-face through videos, podcast,
sure,
and various services to help them know that they're not alone in their own grief, their loss, their change and transition. But it gives them an opportunity to connect with another veteran's story to help them know that there is help through the VA system with any mental health service that they need.
Okay. So I've only been here about, 8 months, and I think within the first week I was hearing about PAC social work. Social work. What exactly is a PAC social worker? What is PACT?
Sure. PAC stands for Patient Aligned Care Team, and I'm so glad that you brought up PAC social work because here at our VA, it is a new component, actually. But every veteran knows that their medical health care provides services through their PAC team. That's what they call it, right? Their primary care physician and their primary care nurse. Well, what we have done is we have added a social worker to that PAC team to help provide resources and support, wraparound services that are necessary so that we can continue that one-stop shop.
Okay, awesome. I mean, that sounds, like in terms of like trying to benefit the veteran as much as you can. You want to try to make it easy for them to know where to go, things like that. So
absolutely. The medical providers help them in regards to identification of medical services, medications. Social workers help them with the social aspect and the services and needs. Advanced directives, medical power of attorney, resources that most of your nurses and doctors may not have information for.
Mm-hmm. So, going through, it's a full 2-page spread. I don't know if I could talk about every program, but one of the other programs that I really am interested in is mainly because we've had Melissa Vasquez in here before. But
absolutely.
Can you tell me a little bit about, let me make sure I got this right, Partner Violence Assistance Program, or
correct.
Intimate Partner Violence Assistance Program. There we go.
IPV, Intimate Partner Program, and it's actually a program that helps not only our veteran and caregiver population, meaning the spouses of the veteran, But it also is a program which, in a unique way, is set up for the staff as well. So this particular program helps a multitude of individuals. Yes, and so it is information regarding domestic violence, intimate partner violence, screens for such disparities, and helps to provide resources, mental health support, social supports for those who may be in danger. Yeah.
Well, sounds very important, at least in terms of somebody that's going through that.
Absolutely, absolutely.
In terms of, because there's a lot of detail, and I'm sure every social worker within the West Texas VA, they're experts. They know their program very well. But
yes,
in terms of a veteran, I always try to turn back to how is this going to benefit the veteran? What do you think is the most important thing for a veteran to know in terms of social work? Like, that might not be a word or a program or anything like that they're familiar with. What do you feel like is the most important takeaway that you would want a veteran to recognize?
I want the veteran and the caregiver to know that there is a social worker at every facility in West Texas. And so the VA has a unique opportunity that not only do we have a mental health component, but that we have a generalized social work service component. So if they have a question, they have a need, they have a concern, for them to pick up the phone, and when they call the main number or they call their facility or they secure message their PAC provider, if they have a question or concern regarding social service and supports, ask for the social worker. You don't have to know anyone's name specifically. You just need to let them know what kind of support and service you need, and that will allow us as a facility to be able to connect you with a human, a social worker who is licensed, who is educated, and who is trained to provide the care and service in which you need.
Good deal. Awesome.
Yeah.
All right. So if I'm a veteran, I'm watching this video, I'm interested, I need help with something.
Sure.
How does one get a hold of a social worker? It's not like there's, you look it up in a phone book or something like that.
Correct. Again, what I would do, my recommendation, call the main facility and or secure message your PAC provider, your mental health provider, and they will be able to reach out, and we will then get you to the appropriate person. Of course, Social Work Service has a direct extension, which is extension 7492. That is our administrative officer, and she knows where everybody is and who needs to be contacted for what. And that is how we get most of our referrals.
So basically, if I'm dealing with a financial struggle, I'm having trouble paying bills or something like that, all I need to do, at least to make that first connection, is just call my local VA clinic.
That is correct. We
Okay.
have many resources that are broken out within the catchment area, various counties and cities and locations. And if we're not able to provide that assistance, we will be very transparent and let you know, but we won't leave you empty-handed. We will provide you resources, referrals, and resources to try to get you that opportunity to feel purpose and value for you to be able to resolve your situation. The VA is not a hand out, it is a hand up. And Social Work Service believes that wholeheartedly.
Well, and I think I'm a veteran myself. I served in the Army
Thank
for
you.
5 years.
Thank you very much.
And I'm a little standoffish when it comes to trying to get help. It took me so long just to get health care. Like I was like, well, I don't need VA health care. I'm healthy. I'm doing all right. But finally I got to this point where I was like, well, maybe I do need help. And so the thing that I constantly hear from other veterans here that I've met through the program, through working here at the hospital, you've earned this, you've earned the right to receive the care that you deserve. So, I don't think there's anything to feel ashamed about or feel like I need to be standoffish about this. So,
Will, I'm so glad that you brought that up. The reality is that we hear that story every time we encounter a veteran.
Sure.
Pride is a wonderful thing, and the military has definitely trained all of our men and women to be self-reliant and self-sufficient. But it is an opportunity just like anyone else in the community. When you need help, and there is nothing shameful or embarrassing. It is an opportunity to provide personal growth and empowerment for yourself to be able to handle your own situation. And in handling that situation, sometimes what you need is information. And Social Work Service can provide the information you need to give you what you need to get it done.
Awesome. All right. Well, thank you so much, Nickie,
You're
for joining
welcome.
us.
Thank you.
I've enjoyed talking to you about social work and learning a little bit more about it.
Absolutely.
Extend this opportunity for any veterans or anybody out there that feels like there's, a question that you have, you want us to answer something that you want. There's a lot of programs, not just social work, but there's just a lot of different aspects of the VA hospital that you may not know about and that you might be able to benefit from. So,
Absolutely.
Reach out to us anytime. We'll put our contact information out there. But again, thank you for joining us. This has been
you.
Vital Signs Podcast. I'm Will Hatton, and we'll be with you next week.